Thank you. And finally, Joshua Hordern is an associate professor in the theology faculty here, and for his project, Compassion in Healthcare, he worked with the Royal Society of Medicine Open Section to explore ways of serving clinicians, researchers, and the broader public by sharing perspectives between academia and practice. And I'd like to extend a special welcome to his knowledge exchange partner. Andrew Papanikitas is a council member of the Royal Society of Medicine Open Section and General Practice and Primary Health Section. He's also a Central Oxford GP and NIHR academic clinical lecturer in general practice, Department of Primary Healthcare, University of Oxford. So welcome to you both.
Okay, great. Well, thank you very much. We were asked to reflect a little bit about the process of knowledge exchange in this period of the Knowledge Exchange Fellowship, which was, I suppose, primarily autumn 2014. And I think what was key for the success of the Knowledge Exchange Partnership was identifying key points of conceptual convergence, areas where we wanted to work together, ideas that we wanted to deepen, and then identifying key collaborators in healthcare and in academia who wanted to focus on compassion together with us. And then lastly, between Andrew and myself, close cooperation. How are we going to actually get the nuts and bolts of this research and knowledge exchange operation going? Working with the Royal Society of Medicine was a fantastic experience for me and really opened up tremendous new avenues for research. In terms of where it's led to, Andrew will comment a little bit in a moment on what we actually did, but what it's led to is actually the founding of a new organisation, the Healthcare Values Partnership within the University of Oxford, which brings together colleagues in law, oncology, palliative care, general practice, and in theology, and then outside the university, the Oxfordshire Clinical Commissioning Group, who are working with us around this theme. They commission health services for the Oxfordshire region. It's led to a suite of new research initiatives, first extending the compassion healthcare work. So we now run seminars, training events for colleagues up at the John Radcliffe Hospital in gerontology most recently, but hoping to move into vascular surgery and other fields as well. People who want to think about the significance of compassion for the practice of healthcare. And working on markets and compassion, markets and healthcare. How does the move towards privatisation make a difference to the practice of care? And lastly, into personalised medicine, working especially with in oncology, but also with the commercial sector as to how they are moving forward individualised genetic related healthcare. To fund this, the initial grants from Torch and the Higher Education Innovation Fund, we're actually successful in getting awards from the British Academy for the Markets Programme, and now from the Wellcome Trust of the Institutional Strategic Support Fund, which has funded a postdoc and a small buyout of my teaching time to be able to focus on continuing the compassion work and moving into personalised medicine. In addition to that, I was invited because of the compassion work to join the Royal College of Physicians Committee for Ethical Issues on Medicine, where I work with them on a range of matters as a theologian. Actually, that spot for a theologian on their committee, which I think is an admirable move. And it's really impacted my own research. So both academic articles and now the plan for my next monograph, which will be called Compassion in Healthcare Practical Policy for Civic Life. So lastly, I was actually invited to join the Royal Society of Medicine Open Section Council, so I've actually joined and now working alongside Andrew in that capacity. And all that was possible because of the innovative work of the Knowledge Exchange team and the Humanities Division, and actually taking forward, I think, this crucial work which we're doing as a university, partnering with external organisations and finding ways of serving the public good, which is what we're all about. Andrew.
Okay, well, how do you follow that? Speaking as the former president of the Open Section of the RSM, which is, the RSM is a federated organisation composed of lots of mini societies ranging from maternity and the newborn to forensics and legal medicine, and the Open Section is the section which concerns itself with issues at the interface between healthcare and society. So it was a marriage made in heaven, you might say. So that was part of the background, and the other part of the background is that of late, certainly in healthcare, we have been very concerned about this concept of compassion. But of course, the problem is when you ask two doctors what they mean by compassion, you get 4 answers. And this has been enormously useful. So I'd echo what Joshua says about the importance of the knowledge exchange for actually providing us with a space to hold some really good knowledge exchange discussions that led from knowledge coming from the ground, coming from frontline clinicians, coming from educators, coming from academics, and actually going into the mix and informing, in one case, an entire day at the Royal Society of Medicine on how can this impact on healthcare education. Ought one teach compassion in some way? Can one teach compassion in some way? And this has ignited, certainly at the RSM, a whole raft of further activities, which includes the Markets and Meaning event that Joshua supported, but also subsequent events actually looking at the role of the literary humanities in healthcare and healthcare education, which spilled over into a torch-supported series of events here involving local academics in healthcare, in poetry, and a visiting scholar from the United States. So it's been an absolute pleasure and privilege.
So last thing to say is thank you very much to the RSM for being so involved in this work and supportive of it. An invitation to those who want to be involved in the project to visit the websites, follow the Twitter hashtag, is it called, and be involved in the research and the knowledge exchange going forward. Thank you.